There is a quiet assumption that most people carry with them into their later years. It is rarely spoken aloud, rarely examined, but it shapes countless decisions about health and daily life. The assumption is this, that the changes we notice as we age, the slower recovery, the moments of unsteadiness, the subtle decline in energy and mental clarity, are simply what aging is. That these changes are inevitable, irreversible, and must be accepted as the natural price of reaching a certain number of years. But what if this assumption is wrong? What if some of what feels like aging is not aging at all, but something else entirely? What if the body is sending signals that are being misread, dismissed as normal when they are actually pointing to something that can be addressed? This is not a question about reversing time or seeking miracles. It is a question about whether we have been aiming at the wrong targets, following guidelines designed for different bodies at different stages of life, and in the process, inadvertently creating the very declines we hope to avoid. There is a growing body of research suggesting that some of the most common health advice given with the best intentions, may be working against older bodies rather than supporting them. The numbers that are held up as ideal, the targets that patients are told to achieve, may not be ideal at all for those who have passed a certain age. And the consequences of reaching those targets, of pushing the body to meet standards designed for younger physiology, can include the very things people fear most: loss of independence, falls, confusion, and a steady erosion of the ability to live life on their own terms. This is not about rejecting medical wisdom. It is about deepening it, understanding that the body at 75 is not simply an older version of the body at 45. It is a different landscape, with different needs, different vulnerabilities, and different requirements for thriving. The question is whether we have been reading that landscape correctly. You are listening to the Longevity Library, where we archive the wisdom of healthy aging, the architecture of a long life, understanding how the body ages and what science reveals about maintaining vitality. There comes a moment in life when the questions shift. The early years are occupied with building, achieving, accumulating. But somewhere in the later decades, a different kind of inquiry emerges. It is less about what to add and more about what to preserve. Less about reaching outward and more about understanding the inner workings of a body that has accompanied you through decades of experience. The question becomes not simply how to live longer, but how to live well through every year that follows. This is not a question with a simple answer. There is no single intervention, no magic substance, no hidden secret that transforms the trajectory of aging. But there is something perhaps more valuable: a coherent understanding of how the body changes over time, and what those changes imply for how we might live in ways that support continued vitality. When you understand why certain things happen, you can work with your body rather than against it. You can make choices aligned with how your physiology actually operates, rather than fighting against misconceptions about what aging should look like. The body through time. What actually changes? Every human body is engaged in a continuous process of maintenance and renewal. Cells divide. Proteins are synthesized. Tissues repair themselves, all in an intricate dance that continues largely beneath conscious awareness. For decades, this system operates with remarkable efficiency. The body maintains stable internal conditions despite changing external circumstances. Blood pressure stays within range regardless of whether you are sitting or standing. Temperature remains constant whether you are in a warm room or a cool one. Blood sugar is carefully regulated regardless of when you last ate. This capacity for maintaining stability is one of the great marvels of biology. But it is not infinite. Over time, the systems that accomplish this regulation gradually change. They do not fail abruptly in most cases, but they shift. Their responses become slightly slower. Their range of comfortable operation narrows. What was once easily managed now requires more effort from the body's regulatory systems. Consider what happens when you stand up. In a younger body, specialized sensors in the blood vessels detect the shift in gravity within fractions of a second. They signal the heart to beat a little faster and the blood vessels to constrict slightly, maintaining steady blood flow to the brain throughout the position change. The entire sequence occurs so smoothly that you never notice it happening. You simply stand, and your body adjusts without any conscious awareness required. In an older body, these same sensors respond more slowly. The signal takes longer to generate, longer to travel, longer to trigger the necessary adjustments. For a few seconds after standing, blood pressure may drop before the body compensates. This is why some older adults feel dizzy when they rise too quickly. The system still works, but it works more slowly. The margin for error has narrowed. This same pattern appears throughout the body. Arteries that were once flexible and elastic become stiffer over time. They do not expand and contract as easily with each heartbeat. This means that maintaining adequate blood flow to organs, particularly the brain which sits at the highest point in the body, may require slightly different conditions than it once did. The same pressure that was perfectly adequate at 50 may be insufficient at 75, not because anything is broken, but because the vessels through which blood travels have changed. The kidneys also change. They filter blood less efficiently with each passing decade. The rate at which they clear substances from the bloodstream slows gradually. This means that medications, which are processed and eliminated largely by the kidneys, remain in the body longer. A dose that was perfectly appropriate at 60 may be stronger at 80, simply because it takes longer for the body to clear it. None of these changes represent disease. They represent the normal, predictable evolution of a human body over time. The challenge is that much of what we think we know about health targets comes from studies of younger bodies. The numbers that are considered optimal, the ranges that are held up as ideals, were largely established in research on people in their 40s, 50s, and early 60s. Applying those same targets to bodies that have undergone decades of natural change can create problems that were never anticipated by the original research. The problem with universal targets. There is a deep human desire for simplicity. It would be so much easier if one number worked for everyone, if one target could be applied across all ages and circumstances. This desire for simplicity has shaped much of medical practice. Guidelines are written with clear numbers. Patients are told to achieve specific targets. Success is measured by whether those numbers are reached. But bodies are not machines with standardized specifications. They are living systems that change over time and differ from one another in countless ways. A target that makes perfect sense for a 50-year-old may be entirely inappropriate for an 80-year-old. Not because the 80-year-old is doing anything wrong, but because the 80-year-old's body is different. This is not a matter of opinion. It is a matter of what the research actually shows when it specifically examines older populations. Studies that have followed large groups of adults over 75 have found patterns that diverge significantly from what the standard guidelines would predict. Those with blood pressure in ranges considered slightly elevated by conventional standards actually show better outcomes in terms of both survival and quality of life than those who achieve the lower numbers typically recommended. The explanation lies in the physiological changes already described. When arteries are stiffer and regulatory reflexes are slower, maintaining consistent blood flow to the brain and other organs requires slightly higher pressure. Pushing pressure too low in this context does not provide protection. It creates risk. The risk of dizziness, the risk of falls, the risk of inadequate blood flow to organs that depend on steady perfusion. This is not to say that significantly elevated pressure is harmless. Very high readings do increase the risk of stroke and other cardiovascular events, even in very old adults. The issue is balance. The optimal range is not the lowest possible range. It is the range that provides adequate organ perfusion while still offering reasonable protection against cardiovascular events. And that optimal range shifts upward with age. The same principle applies to many health targets. What is optimal at one stage of life may not be optimal at another. The body's needs change because the body itself changes. Working with those changes, rather than against them, requires understanding them first. The biology of regulation. To understand why these shifts occur, it helps to understand something about how the body maintains stability in the first place. The human body contains countless regulatory systems, each designed to keep internal conditions within a narrow range despite external fluctuations. These systems operate through feedback loops. Sensors detect a condition. Signals are sent to effectors that make adjustments. The condition is restored to its set point. Then the system waits for the next deviation. This is how body temperature is maintained. When you go into a cold environment, sensors in your skin detect the temperature drop. Signals go to the brain. The brain sends signals to blood vessels in the skin to constrict, reducing heat loss. It may also trigger shivering, which generates heat through muscle activity. All of this happens without any conscious thought, maintaining your internal temperature within a fraction of a degree. The same pattern applies to blood pressure, blood sugar, fluid balance, and countless other physiological parameters. The body constantly monitors and constantly adjusts, keeping conditions stable enough for cells to function properly. What changes with age is not the existence of these systems, but their speed and precision. The sensors become slightly less sensitive. They do not detect deviations quite as quickly. The signals travel along pathways that may have some degradation. The effectors, the muscles and glands that make the adjustments, may respond a bit more slowly. The entire loop still works, but it works with less margin for error. This is why older bodies are less tolerant of extreme conditions. A younger person can eat a large amount of sugar and the insulin system responds rapidly, bringing blood sugar back to normal within a predictable time frame. An older person may have a slower response, meaning blood sugar stays elevated for longer. A younger person can stand up quickly without any sensation because the pressure regulation system responds before any symptoms occur. An older person may feel dizzy because the response takes a few seconds longer, allowing pressure to drop transiently. These changes are not failures. They are the natural result of decades of operation. Every system that runs continuously will eventually show some slowing, some loss of precision. The challenge is to live in ways that accommodate these changes rather than pushing against them. The principle of adequate reserve. One way to think about aging is in terms of reserve capacity. A younger body has substantial reserve. It can handle wide fluctuations in conditions without difficulty because the regulatory systems have plenty of capacity to respond. If something goes slightly wrong, there is plenty of margin to compensate. With age, reserve capacity diminishes. The systems still function, but they have less extra capacity to draw upon when conditions are challenging. This means that events that would have been trivial at a younger age can become significant. A minor infection that would have been shrugged off at 40 can be debilitating at 80 because the body has less reserve to devote to fighting it while maintaining all its other functions. A medication that caused no symptoms at 60 can cause significant side effects at 80 because the body has less reserve to compensate for its effects. This diminishing reserve is not something to be feared. It is something to be understood. When you understand that reserve is limited, you make different choices. You pay attention to the margins. You avoid unnecessary stresses that would have been inconsequential earlier. You pay attention to early signals that might have been ignored before. The goal is not to reverse the loss of reserve, which is a normal part of aging. The goal is to avoid depleting reserve unnecessarily. so that it remains available for when it is truly needed. This is why the concept of adequate becomes more important than the concept of optimal. The question shifts from what is theoretically best to what is practically sufficient for maintaining function and quality of life. The brain's constant need. Among all organs, the brain has the most urgent and continuous need for adequate blood flow. It represents only about 2% of body weight, but consumes approximately 20% of the oxygen used by the body. It has no energy reserves of its own. It cannot store glucose or oxygen for later use. It depends entirely on continuous blood flow to deliver what it needs moment by moment. This is why the brain is so sensitive to reductions in blood flow. Even brief decreases can cause symptoms: dizziness, confusion, difficulty thinking clearly. If flow is reduced chronically, over months or years, the effects may be more subtle but still significant. Memory may not be as sharp. Concentration may be harder to sustain. Thinking may feel slower or more effortful. These symptoms are often attributed to aging itself, as if they were inevitable. But research using sophisticated imaging techniques has shown that older adults with lower blood pressure consistently show reduced blood flow to specific brain regions. The symptoms may not be from aging per se, but from inadequate perfusion caused by pressure that is too low for that individual's particular physiology. This is a crucial distinction. If the brain is not receiving enough blood, the answer is not to accept cognitive decline as inevitable. The answer is to examine whether blood pressure has been pushed too low, whether medications are too strong, whether the body's need for adequate pressure is being respected. In many cases, adjusting medications to allow pressure to rise slightly results in improved cognitive function, clearer thinking, and better energy levels. The brain also depends on stable pressure, not just adequate pressure. Fluctuations can be as problematic as consistently low readings. When pressure drops sharply upon standing, the brain experiences a transient reduction in flow that can cause immediate symptoms. Over time, repeated episodes of orthostatic hypotension may have cumulative effects, each temporary reduction in flow potentially causing microscopic damage that adds up over years. This is why the simple test of measuring blood pressure lying and then standing is so informative. It reveals not just what pressure is at rest, but how well the body maintains stability during position changes. A drop of more than 20 points systolic or 10 points diastolic upon standing indicates that the regulatory system is struggling. It may mean that baseline pressure is too low, that medications are too strong, or that the body's compensatory mechanisms are particularly slow. Whatever the cause, it is information that can guide adjustments. The kidneys and their requirements. The kidneys have their own requirements for adequate pressure. They filter blood by forcing it through microscopic structures under pressure. If systemic pressure drops too low, filtration slows. Waste products that should be eliminated accumulate in the blood. Fluid balance becomes harder to maintain. This is why acute kidney injury can occur when blood pressure is lowered too aggressively, particularly in older adults whose kidneys may already have some reduced function. The kidneys are not getting the pressure they need to do their job. The result can be a rapid decline in kidney function that requires hospitalization and may not fully recover even when pressure is restored. For those with pre-existing kidney disease, which becomes more common with age, this risk is even greater. What appears to be progression of kidney disease may actually be the result of pressure that has been lowered below the threshold necessary for adequate filtration. The kidneys are not failing because of disease progression. They are failing because they are not receiving enough pressure to function. This is another example of the need for individualized targets. For someone with healthy kidneys, a slightly lower pressure may be perfectly well tolerated. For someone with compromised kidneys, the same pressure may be insufficient. The organs themselves determine what is adequate, not a universal number from a guideline. The skeleton and the risk of falling. The skeleton changes with age as well. Bone density gradually declines. This process accelerates in women after menopause, but affects both sexes over time. Bones become more brittle, more susceptible to fracture under stress that younger bones would withstand easily. This makes falls a particular concern. A fall that would result in bruises at 50 can result in a fractured hip at 80. And a fractured hip in an older adult is not simply a broken bone that will heal with time. It is often the beginning of a cascade. Surgery carries risks at older ages. Immobility after surgery leads to muscle wasting and further weakness. Pneumonia can develop from shallow breathing during recovery. The loss of independence that follows can be devastating, both psychologically and physically. Many people never fully recover the mobility they had before a serious fall. They move from independent living to requiring assistance. Their world shrinks from the community to the home. The activities that gave life meaning become difficult or impossible. This is why fall prevention becomes increasingly important with age. And one of the most significant and modifiable risk factors for falls is orthostatic hypotension. When blood pressure drops upon standing, the resulting dizziness or lightheadedness can directly cause a fall. The person stands up, feels unsteady, reaches for support, misses, and goes down. It happens in seconds. The tragedy is that this risk is entirely detectable and largely modifiable. A simple 2-minute test reveals whether orthostatic hypotension is present. Adjusting medications, ensuring adequate hydration, and sometimes simply allowing pressure to run slightly higher can eliminate the problem entirely. But if no one performs the test, if the dizziness is dismissed as normal aging or attributed to something else, the risk continues unaddressed until a fall occurs. The heart's changing demands. The heart itself changes with age. The muscle may thicken slightly. The chambers may enlarge. The electrical system that coordinates contractions may develop minor variations in its timing. None of these changes necessarily indicate disease. They are part of the heart's adaptation to decades of continuous work. What matters for blood pressure management is understanding that the heart requires adequate pressure during both phases of its cycle. During systole, when the heart contracts, it generates the pressure that pushes blood through the arteries. During diastole, when the heart relaxes, the coronary arteries fill with blood, supplying the heart muscle itself with oxygen and nutrients. If diastolic pressure drops too low, below about 60, the heart muscle may not receive adequate blood flow during this critical relaxation phase. This can cause chest pain, shortness of breath, or other symptoms of inadequate cardiac perfusion. It can also increase the risk of heart attack, even in the absence of blocked arteries, simply because the supply of blood to the heart muscle is insufficient. This is why very low diastolic pressure is concerning in older adults. The heart needs that relaxation phase to receive its own blood supply. Pushing diastolic too low in an effort to achieve a particular systolic target can starve the heart of what it needs to function. The question of medications. Medications for blood pressure are among the most commonly prescribed drugs in the developed world. They have undoubtedly prevented countless heart attacks and strokes in people whose pressure would otherwise have remained dangerously elevated. But like all powerful interventions, they require careful matching to the individual. The challenge with blood pressure medications in older adults is that the body processes them differently than younger bodies do. Kidney function, which clears many of these drugs from the system, typically declines with age. Liver metabolism may slow. Body composition changes, with increased fat percentage affecting how drugs are distributed. All of these factors mean that a standard dose can have stronger and longer-lasting effects in an older person than in a younger one. This is why the concept of starting low and going slow is so important. beginning with a lower dose than would be used in a younger person, then increasing gradually while monitoring for effects, allows the body time to adjust and reveals whether lower doses might be sufficient. Many older adults achieve adequate pressure control with doses far below what standard guidelines suggest, simply because their bodies handle the medication differently. It is also why periodic medication review is essential. Medications that were appropriate at 70 may be too strong at 80, simply because kidney function has declined further. The same dose that was well tolerated for years may suddenly cause symptoms as clearance slows. Regular review, including discussion of any new symptoms like dizziness or fatigue, allows for adjustments before problems occur. Some older adults end up on multiple blood pressure medications, each added over the years as pressure crept up slightly. Periodic review may reveal that not all are still necessary. Reducing or eliminating one medication may resolve symptoms while maintaining adequate control. The goal is the minimum effective intervention, not the maximum tolerable. The role of hydration. Fluid balance becomes more critical with age for several reasons. The sensation of thirst diminishes, meaning older adults may not feel thirsty even when they need fluids. Kidney function changes affect how the body conserves water. Medications, particularly diuretics, can increase fluid loss. Dehydration can directly affect blood pressure. When fluid volume is low, pressure drops. This can exacerbate orthostatic hypotension, making dizziness upon standing more likely. It can also make blood pressure more variable, harder to control with medications. Simple attention to fluid intake can make a significant difference. Spreading fluid intake throughout the day, rather than drinking large amounts at once, helps maintain consistent hydration. Paying attention to urine color, aiming for pale yellow rather than dark, provides a simple check on hydration status. For those taking diuretics, discussing with a physician whether the dose remains appropriate can prevent unnecessary fluid loss. Movement and the circulatory system. Physical movement plays a direct role in circulatory health. When muscles contract during activity, they compress the veins running through them, helping push blood back toward the heart. This muscle pump action supports circulation and helps maintain blood pressure during upright activities. Regular movement also helps maintain the sensitivity of the baroreceptor reflex. The system that detects pressure changes and triggers adjustments benefits from regular use. People who remain physically active tend to have better maintained autonomic function, with faster and more precise responses to position changes. This does not require intense exercise. Walking, gentle stretching, activities of daily living performed with intention, all contribute to maintaining the body's regulatory systems. The key is consistency. Regular, moderate movement throughout the week supports circulation and helps maintain the body's ability to adjust to changing demands. Movement also builds and maintains muscle mass, which is protective in multiple ways. Stronger muscles provide better support for joints, reducing fall risk. More muscle mass means higher metabolic rate, which helps with weight management. Muscle tissue also serves as a reservoir for amino acids that the body can draw upon during illness or stress. Nutrition patterns that support stability. What we eat affects blood pressure and circulation in countless ways. The relationship is complex, but certain patterns emerge consistently from research. Sodium intake affects fluid balance. For some people, high sodium intake leads to fluid retention and increased blood pressure. For others, the effect is minimal. The key is awareness and moderation rather than extreme restriction. Very low sodium diets can actually be problematic for some older adults, particularly if they also take medications that affect sodium balance. Potassium, found abundantly in fruits and vegetables, helps counterbalance sodium's effects and supports healthy blood vessel function. Magnesium plays a role in muscle relaxation, including the smooth muscle and blood vessel walls. Calcium is involved in vascular contraction and relaxation. These minerals work together in complex ways that are not fully understood but clearly matter for vascular health. Adequate protein intake becomes increasingly important with age. Muscle loss, sarcopenia, is a major contributor to frailty and fall risk. Protein provides the building blocks for maintaining muscle tissue. Spreading protein intake across meals, rather than consuming most at one meal, may support better muscle maintenance. The overall pattern that emerges from research is one of variety and adequacy rather than restriction. Diets that include a wide range of whole foods, with plenty of plants and adequate protein, tend to support better health outcomes than diets focused on eliminating particular nutrients or food groups. Sleep and circadian rhythms. Sleep patterns change with age. Deep sleep decreases. Nighttime awakenings become more common. Falling asleep may take longer. These changes are normal, but they matter for cardiovascular health. Blood pressure normally dips during sleep, a phenomenon called nocturnal dipping. This dip gives the cardiovascular system a period of relative rest. When sleep is disrupted, this dipping may be blunted or absent, meaning pressure remains higher throughout the 24-hour cycle. Poor sleep also affects the autonomic nervous system, shifting balance towards sympathetic dominance, the fight-or-flight state. This increases heart rate and blood pressure, and reduces the body's ability to relax and recover. Attention to sleep hygiene can help. Consistent bedtimes and wake times, even on weekends, support circadian rhythms. Exposure to light during the day, particularly morning light, helps maintain proper timing of sleep-wake cycles. A cool, dark, quiet sleeping environment supports deeper sleep. Limiting fluids before bed reduces nighttime awakenings to use the bathroom. For those who wake frequently, discussing with a physician whether any medications might be contributing is worthwhile. Some blood pressure medications, particularly those that increase urine output, can disrupt sleep if taken too late in the day. Timing adjustments may improve sleep without changing the medication itself. The nervous system and stress. The autonomic nervous system, which controls involuntary functions like heart rate and blood pressure, has two main branches. The sympathetic branch mobilizes the body for action, increasing heart rate and blood pressure. The parasympathetic branch promotes rest and recovery, slowing things down. With age, the balance between these branches may shift. Sympathetic activity tends to increase relative to parasympathetic, meaning the body spends more time in a state of readiness and less time in recovery. This contributes to higher baseline blood pressure and less flexibility in responding to challenges. Stress, whether from external events or internal worries, activates the sympathetic system. Chronic stress means chronic sympathetic activation, which can keep blood pressure elevated and reduce the body's ability to regulate effectively. Approaches that support parasympathetic activity can help restore balance. Slow, deep breathing activates the vagus nerve, a major parasympathetic pathway. Gentle movement like walking or stretching can shift nervous system state. Activities that engage attention in a calming way, whether reading, listening to music, or spending time in nature, all support parasympathetic function. The goal is not to eliminate stress, which is impossible, but to create regular periods of recovery that balance the inevitable periods of activation. Brief pauses throughout the day, moments of intentional calm, can shift the overall balance toward greater resilience. Social connection and purpose. Human beings evolved in groups. Our physiology reflects this social nature. Isolation and loneliness are not just emotional states. They have measurable physiological effects. Loneliness is associated with higher inflammation levels, higher blood pressure, and greater cardiovascular risk. Social connection, by contrast, supports regulation. Being with trusted others activates parasympathetic pathways. Conversation, shared activity, simple presence, all contribute to a physiological state of safety and calm. This is not about having a large social network. Quality matters more than quantity. A few close relationships provide more regulatory support than many superficial ones. The key is regular connection with people who know you, who you trust, who you can be yourself with. Purpose also matters. Having reasons to get up in the morning, activities that feel meaningful, projects that engage attention, all support health. Purpose provides motivation for self-care, for staying active, for maintaining connections. It orients behavior toward the future and gives life a sense of continuity. For many older adults, retirement creates a gap in purpose that was previously filled by work. Filling that gap requires intentional effort. Volunteer activities, creative pursuits, time with family, learning new things, all can provide the sense of purpose that supports continued engagement with life. Environment and daily patterns. The physical environment shapes behavior in ways that are easy to overlook. A home that requires navigating stairs multiple times per day supports more movement than a single-level home where everything is on one floor. A neighborhood with sidewalks and nearby destinations supports more walking than one where driving is required for every errand. Small environmental modifications can make a difference. Removing tripping hazards reduces fall risk. Good lighting, particularly at night, makes navigation safer. Grab bars in bathrooms provide support when needed. None of these changes are complicated, but they can prevent problems. Daily patterns also matter. The body operates on rhythms that repeat approximately every 24 hours. Eating, moving, sleeping at consistent times supports these rhythms. Erratic schedules disrupt them. Regularity, within reason, supports regulation. This does not mean rigid adherence to a schedule. It means paying attention to patterns and maintaining consistency where it matters. Regular meal times support metabolic regulation. Regular bedtimes support sleep. Regular movement throughout the day supports circulation and muscle maintenance. The integration of strategies. None of these elements operates in isolation. They interact, each influencing the others. Good nutrition supports energy for movement. Movement supports better sleep. Better sleep supports clearer thinking and better mood. Better mood supports social connection. Social connection provides motivation for all the others. This is why a philosophy of living is more useful than a list of tips. The goal is not to execute a set of discrete interventions perfectly. The goal is to create conditions that support the body's natural regulatory systems in doing what they already know how to do. The body wants to maintain stability. It wants to regulate pressure, maintain flow, support function. It has been doing these things for your entire life. What it needs is conditions that allow it to continue doing them effectively. This means avoiding extremes that overwhelm regulatory capacity. Very low blood pressure, very low sodium, very low food intake. All push the system away from its natural operating range. So do very high levels of stress, very poor sleep, very sedentary patterns. The body works best in the middle ranges, where demands are moderate and resources are adequate. It also means paying attention to signals. Dizziness upon standing is not normal aging. It is information. It tells you that the regulatory system is struggling. Fatigue that persists despite adequate sleep is information. It tells you that something may be out of balance. Confusion or difficulty concentrating is information. It tells you that the brain may not be receiving what it needs. The temptation is to dismiss these signals, to attribute them to age and accept them as inevitable. but they are often modifiable. They point to specific adjustments that could improve function. The person who notices dizziness upon standing can have their blood pressure checked lying and standing. They can review their medications with a physician. They can ensure they are adequately hydrated. They can rise more slowly, giving their slower reflexes time to compensate. All of these responses address the signal rather than dismissing it. The question of numbers. Numbers have power. They give us something to track, something to aim for. Blood pressure numbers, cholesterol numbers, blood sugar numbers, all provide information that can guide decisions. But numbers are not the goal. They are indicators. They tell us something about how the system is operating, but they are not the system itself. The goal is function. Can you do what you want to do? Can you walk where you want to walk? Can you think clearly enough to engage with the people and activities that matter to you? Can you maintain your independence and your quality of life? These are the questions that ultimately matter. Numbers that support function are useful. Numbers that undermine function, even if they look good on paper, are not. A blood pressure reading that is perfect by textbook standards but leaves you dizzy and fatigued is not a success. It is a signal that something is wrong, that the intervention is mismatched to your particular body. This is why the conversation with healthcare providers matters so much. It is not about challenging their expertise or refusing their recommendations. It is about providing them with information they may not have. They cannot know that you feel dizzy upon standing unless you tell them. They cannot know that your medications are causing fatigue unless you describe it. They are working with incomplete information unless you complete the picture with your own experience. The best medical decisions are collaborative. The physician brings knowledge of physiology, pharmacology, and research. The patient brings knowledge of their own body, their own experience, their own goals. Together, they can find the approach that works for this particular person, at this particular stage of life. The long view. Aging is not a problem to be solved. It is a process to be understood and accompanied. Every person who reaches later decades has already navigated countless challenges, adapted to countless changes, found ways to continue living meaningfully through all of it. The skills that got you here are the same skills that will serve you going forward. Observation, adaptation, persistence. The body you have today is not the body you had at 20. It has accompanied you through everything, adapted to everything, kept going through everything. It deserves respect for that. It deserves attention to its changing needs. It deserves care that is appropriate to its current state, not care based on what worked at a different time. The research on aging is still evolving. What we think we know today will be refined and sometimes overturned by future studies. That is how science works. But certain principles have stood the test of time and are likely to remain valid. The body needs adequate resources to function. It needs conditions that support its regulatory systems. It needs attention to its signals. It needs respect for its limits and support for its capacities. Living well with aging is not about finding the one secret that changes everything. It is about integrating many small understandings into a coherent approach. It is about paying attention, making adjustments, and continuing to engage with life on its own terms. It is about recognizing that the goal is not to stop the clock, but to live fully through whatever time remains. The years ahead are not a problem to be managed. They are life itself, as real and valuable as any that came before. Approaching them with curiosity rather than fear, with attention rather than denial, with respect for what the body needs rather than insistence on what it should be, is the foundation of continued vitality. Not eternal youth, which is not possible, but engaged living, which is available to anyone who chooses it. The body knows how to age. It has been doing it since the moment you were born. Your job is not to fight that process, but to support it, to provide what it needs to continue functioning as well as possible for as long as possible. That is enough. That is everything. The single most important truth to carry forward is this. The body you have today is not the body you had at 40, and treating it as though it were, aiming at targets designed for a different stage of life, can create problems that look like aging but are actually something far more reversible. The signals it sends, the dizziness upon standing, the fatigue that persists, the mental fog that comes and goes, are not simply messages to be dismissed. They are information, and information can be acted upon. If this reflection has stirred something in you, a recognition, a question, a memory of your own experience, we would welcome your thoughts in the comments. What have you noticed in your own body that you may have dismissed as normal? What questions does this raise for you about the advice you have received? There is wisdom in shared experience, and this library is richer when voices join the conversation. If you would like to continue exploring the archives, you will find more reflections on the art and science of living well across the decades. Subscribe so that new wisdom finds its way to you when it is published. This is the Longevity Library. Listen, learn, and live longer.